Okay. Good evening, everyone. Am I audible? Please put it on. Okay. Um, Before we quickly start, I would like to know how's the energy like today. So, out of 1 to 10, how has your day been so far? So, you can either put it up in the comments or you can like talk it out. So, I'm feeling like a 6 because I had a really long day. But it's a 10 right now because I'm excited to take this workshop for you all. What about everyone else? We have a good number of people, right?
Hi, your sound is very low. We can't hear you clearly.
Oh, okay. 1 minute. Now, am I audible? Am I audible to everyone?
You're audible, but it's
Yes,
still
ma'am.
low.
Oh,
Can you turn the volume up?
can you please try rejoining again?
Okay, I'll do that. Okay, thank you.
Thank you. Okay, quickly, can everyone just drop a rating from 1 to 10 how your mood is or how your day has been until now? Or like you can use the emojis, expressions over there. Okay, a 6. That's good. A 5, a 6. Everyone is in 6 and 5s. I hope everyone has like a good resting day as well. Oh, that's great. Looking forward to explain it to you guys as well. So, before we begin, I would like to quickly introduce myself. Hi, my name is Vanchika, and today I'll be taking a workshop about understanding alcoholism through the brain lens. Uh, I work under supervision of Ria ma'am. So today, what all you'll be learning is what alcohol use disorder is, what assessments are being used for like on clients, a case study to have a better understanding different other types of alcohol disorders, and also to understand a little bit a small chunk of neuropsychology and the cognitive implications when it comes to people who induce alcohol. So don't worry when it comes to the brain lens part because I kept it very simple, since some might have some knowledge, some may not have a knowledge about it. So yeah, and whenever I stop, you guys can ask in questions, or if in case the time is running short, then maybe text in all your questions in the comment section so that after the entire workshop is done, I can uh, answer all of them. And if in case I'm going way too fast, do let me know. And yeah, it's a very free space. It's a very like you can discuss whatever your views are. If you had any experiences or you have seen any other cases during your practice, you can all share. It's a very share free place. So with that, I would like to question all of you to what do you think about the whole concept of why do people drink in the first place? Like you can either write one reason to why people turn to alcohol, or if someone wants to speak and let me know, you are free to do that as well. So why do people drink is the question. So Shweta ma'am mentioned peer pressure and projection. That's a good response. What about others? Depression, yes. Low self esteem to escape from reality, perfect. Cope with sadness, yes. So, as a lot of you have mentioned, uh, there are like factors or stressors that leads to a person to just have a drink because One mentioned family and money issues or to relieve stress, childhood issues to cope with sadness, so many pointers, right? So, with this itself, we understand that alcohol, we use it more to cope with something. We have an issue or a situation and we cope with that. We want to numb ourselves because that's what alcohol does to us, or any other substance, right? But it's not like someone craves for it. They crave it after they're dependent on coping with the help of alcohol. So, with that, we'll first understand what alcohol use disorder is. But what other misconceptions can you give with this disorder? Like, what are the myths have you heard, or those who drink a lot, what do you think they think the misconceptions can be? Anybody? What do you think some misconceptions can be when it comes to alcohol use disorders? For example, I'd say one misconception is that only daily drinkers are at risk. There are only those who drink every day or almost every other day, they have alcohol use disorders. But in reality, it is just that binge drinking and periodically, if you are a heavy drinker, you can meet the criteria for AUD, which is alcohol use disorder. So some responses are alcohol is the best stress reliever. Yes. Person is not good. Yes. They are in control. Yes, so these are some myths that are there. They tag themselves as I'm not an addict and not aware of alcoholism as a disease. I just slowly correct with the word disease. So these disorders aren't really diseases, they are more, um, it's a disorder, it's not a disease. It's somewhat like a condition that can be controlled. I wouldn't say completely cured, but when it comes to alcohol disorders, yes, they can be completely stopped, but with right intervention, the relapse prevention can be done, but wouldn't say it's a disease. I saw someone raise their hand. Would you like to share something? No one? Okay. So, yes, whatever misconceptions everyone typed in, all of them are right. They say that they stop, like some of them, they also say that I suddenly stopped drinking just because it's safe. So, that is also something that comes under this disorder, because when you suddenly stop drinking, it can cause withdrawal, and sometimes a medication is kind of required to prevent from relapse, along with other natural preventions as well. Now, according to DSM, we'll try to understand alcohol use disorder. If you're unable to see the image, do let me know so I can zoom in the image. All right. So, when it comes to the features, or to understand what it is basically defined as a pattern of problematic drinking that leads to physical, emotional, and social difficulties. And it also includes behavior like craving, tolerance, and withdrawal. And over here, craving in the sense, since they're so used to drinking alcohol to cope with their situations or their stressors, that's when they crave for alcohol. They just don't drink alcohol just because. So, or sometimes even that happens when they're way too dependent on it. And as I mentioned, some terms, that is withdrawal or tolerance or craving. So when it comes to withdrawal, when someone who drinks heavily, or they suddenly stop, or they try to cut down, they may experience sometimes symptoms like anxiety, or they randomly shake, sweating, nausea, or even trouble sleeping for within like a few hours. So these symptoms can usually last for like several days, or even sometimes it can persist at like very low intensity for like months, making relapse more likely. There was this one client where he mentioned that he would simply take like two glasses of whatever drink is available at his home, and he would go to sleep after end of the day. And this is something that he would do every single day. And because of that, he did not really like that habit, and he was also saying that, I am not an addict, but I just like this, and I don't know how to stop it, but I would like to try to stop it. So over here, even though he was, and then we mentioned that, how are you planning to do it, or what suddenly made you do that? And he mentioned that, I don't know, I just felt I was unhealthy, and I tried one day that to not drink at all. For like 2 days I tried, and I couldn't do it. I couldn't sleep at all, and the next day it was such a mess. So it just shows like a very slight dependency on alcohol, because he didn't like his workplace. So you see how relapse could be, or like a withdrawal could be like a symptom over here. So that is what withdrawal means in alcohol disorder. Then comes tolerance. So over a period of time, a person, they need to drink more to feel the same effect. So let's just say there are two types of drinkers, right? There are the light drinkers and the heavy drinkers. So for the light drinkers, maybe let's just say they had like one glass of alcohol, any brand. Okay, they had one glass or like two glasses. They feel like, oh, okay, fine. Like I am a little drunk right now, and then slowly as they get used to it, every single time something bad happens, they have two glasses, because they know that two glasses do numb them up. But then over a period of time, those two glasses are not enough. Even if they drink a whole bottle, even if they drink more than two glasses, that's when it kicks in. So those two glasses became their tolerance. The more they drink, just to feel the same effect as two glasses, is one of the symptoms or signs that shows some features of alcohol use disorder. Third comes craving. So there's a strong, often uncontrollable urge to drink. Like it becomes very difficult to focus on anything else until and unless they had at least one glass of alcohol. And this is very common in people, like you have seen in some rural areas, on how there are these men who continuously drink to the point, even if they don't drink, they get so agitated that they indulge in like stealing money, or beating their wife to, like, take money from them just so that they can get a drink. They do gambling just so that they can get money and get a drink. So they just have this strong urge, like they cannot stay a day without drinking. So as drinking continues, it often affects their daily life as well. They skip from work, or if it's like very underage people, they skip from school, they perform very poorly. Whatever responsibilities that they have, they neglect all of them. And drinking can also be very dangerous in some situations. Like some, they drink and drive. There are so many cases like that. There have been cases where people would drink with their friends, and then they would go to beach, and they would drown and they pass away, sadly. And despite knowing the harm, individuals still continue to drink, because it's, for them, it's their brain reward system has been adapted to alcohol. Just remember what brain reward system is. We'll get there. And it makes it extremely difficult for them to stop without any like external help coming from for them. Now, I hope everyone understood like the basics of what this disorder is, right? Any questions? The slides will be added to the resources that will be given along with the certificate. So if you want the slides or any assessments that I'll be talking about, and other worksheets regarding this workshop, will all be given in a resources drive along with the certificate. And if you want access of both of them, then you have to pay for 129 to get both. But yes, you will get access to the slides.
Ma'am,
Yes, yes, ma'am.
ma'am, I want to know that matlab, uh, if a person is knows known that alcohol is not good, but why it consumed the first time, like first, then second, then third? Why in the beginning he knows and he can stop, but why he can't?
Okay, so usually people do drink alcohol as starters, maybe because of peer pressure, or maybe because they wanted to try what it means and everything, right? So let's just say in college settings, they start drinking alcohol because their friends are there, their friends are doing it, so they want to do it. But over a period of time, they realize that they liked the kick of it, so now they want to keep on doing it, right? Now, um, even when someone knows that alcohol is harmful, they cannot stop, it's not simply about their willpower or choice to stop it. Because obviously, alcohol has its own chemicals that is so infused within our system that it has a control of our emotional regulation, our habit, our psychological dependence on it. So remember when I said brain reward system? So when a person consumes alcohol, they get large amount of dopamine. So that's like their pleasure or reward, that it just starts, how do I say, it starts exploding. Like there's a lot of dopamine exploding throughout your body, throughout your brain. So over a period of time, that person's brain, it learns to associate their alcohol as, okay, if I have alcohol, I'll get comfort. So if I want some sort of pleasure with food or with music or with friends, I need alcohol. Then like the brain just ends up starts to like crave alcohol, not just for pleasure, but it slowly ends up being just to feel normal they have alcohol. So their mindset is like, if I don't drink, I'll become worse. The same thing with smoking as well. People know smoking is bad for them, but any instant they are stressed, they need to smoke. They are having a bad day, they need to smoke. They are hungry, they need to smoke. They say I am need to go on a diet, they need to smoke because smoke reduces their hunger levels. So all of this, like, it also affects their emotional regulation, where many people, they just don't get drunk to escape from their reality, like anxiety or sadness or anything. It's just that they know if they have a drink, they can temporarily shut down, and whatever areas like your fear or stress response that happens in your brain, it can just be quiet for a while. You don't need to think about anything. And when slowly that alcohol wears off, their stress hormones, like for example cortisol, it comes up again. And that's when they go like, oh no, I need a drink now. So it's just like, when they're stressed, they drink, they have a temporary relief, and once that relief is slowly going down, more stress comes up and they start drinking again. So even if the person wants to stop, they cannot really stop, because it's no more a pleasure but more of a dependence on drinking. I hope that made sense. Ma'am, did I make sense? Hello? Okay. So we'll just quickly look into the specifiers of this disorder. So specifiers is basically, other than the symptoms that we have seen over here, there are like more to it, where it just basically describes on in what situations it can happen or it may not happen kind of way. So one is in a controlled environment. It means that when the person is in a setting where their access to alcohol is restricted or prohibited is one of these specifiers. So it can be like in a rehabilitation center, a jail, or a hospital. Second is to see the severity levels. So it is determined on obviously the diagnostic criteria. So the mild levels would be 2 to 3 symptoms. So just like there are 11 symptoms over here, right? So if 2 to 3 symptoms are there, then it's mild. If there are 4 to 5 symptoms, it's moderate. If there are six or more symptoms, it is severe. And the clinicians, they also access how often and how much the person drinks by using self reports, which will be looking for like as we go with the workshop. And also they talk with the family to see how like severe it is. The therapist's own observation or the client's observation on how much they feel that they drink. And even sometimes they use medical tests also. They see medical tests to, like, test your liver enzyme levels or any other area that shows that a lot of alcohol has been used. And obviously there is like it is associated with psychological, as some of you mentioned, like there's depression, there's anxiety, or also insomnia. So it can proceed from resulting of the heavy drinking. Their behavior can be changed where uh, they can mix up other substances like cannabis. They can use sedatives or stimulants or just smoking or other substances like weed. There are many substances if we have to like go with that list of substances. And also to manage the stress or to enhance effects, the behavioral changes are being seen. Sometimes even anger comes in place as one of the behavioral change. The other one is physical way, where there's a long-term heavy drinking can harm nearly every organ system. So if we talk about digestive system, there will be like inflammation or stomach lining. There can be ulcers, liver damage, or for when it comes to the heart, high bp, heart disease, or even cholesterol levels, because it's like fermented drink, right? So there'll be a lot of cholesterol levels. And when we have to talk about nervous system, there's nerve damage which causes numbness or tingling, because alcohol has its own chemicals that helps in numbing our body. And this coordination problem, some may not able to work properly because of how intoxicated they are, or they even have memory loss, because uh, sometimes a lot of dopamine can, or a lot of stress, all of this can end up memory loss. And also constant numbing of your brain, constantly saying like, no, be quiet, I don't want to think about anything. Even that gradually hinders some associations with the brain that leads to memory loss. If we have to go more into the brain function, then like you can say that how chronic alcohol, it leads to an irreversible cognitive impairments like vitamin deficiency, especially thiamine deficiency is one way you can search it up. So it can cause one syndrome called Wernicke's Korsakoff syndrome. So it's a very severe type of memory disorder that can happen because of chronic uh, alcohol use. Basically, over here is that there is a severe deficiency in vitamin B1. So because of alcohol misuse, it can lead to also like a cause of malnutrition that leads to deficiency of this sort of vitamins. And one last thing I would like to like mention about when it comes to alcohol use disorders, suicide and mental health risk. So alcohol significantly increases the risk of suicidal thoughts and behaviors, because you're really sad, everything is going so badly around you. You will intoxicate yourself so much and you speed drive, and it leads to a car crash. So it can happen during intoxication, or when the alcohol triggers short-term depressive or bipolar symptoms, or when alcohol lowers inhibition and worsens your mood instability, making that makes a person more impulsive, or like self harm is something that could be more likely when it comes to people who have this kind of disorder. All right, so we'll just quickly run through different types of different disorders that's related to alcohol. One is alcohol intoxication. So over here, it's like clinically significant with their behavior or the psychological changes, as I mentioned before, where there's aggression, there's impaired judgment, there's poor coordination, and there's also physical signs like slurred speech, unsteady gait, and all of these they develop within minutes to hours of consumption, and it can also last for several hours. So maybe like the earlier stages could be euphoria and their sociability, and the later stages could be their depression or irritability or cognitive impairment. This particular condition is particularly very prevalent among people from 18 to 25, because environmental cultural factors like peer pressure or social norms around drinking, they simply have a drink, they have a good time, and that's what is alcohol intoxication. We wouldn't really call it as a disorder on earlier stages to those who have like a balance on like how can they can control their drinking, but we would call them being alcohol intoxicated when they go overboard or when they meet like few of the symptoms that is there in the criteria. Second is alcohol withdrawal. uh, s- like over here is when you suddenly stop drinking or when you reduce the way you drink of heavy and prolonged drinking. So it is categorized with tremors, sweating, nausea, insomnia, anxiety, and when we go in severe cases, it leads to seizures or delirium. So over here also the symptoms, they usually start within 4 to 12 hours after the last drink, and it peaks within 2 days and it resolves within 4 to 5 days. So the when you withdraw alcohol, your body's physiological dependence on alcohol and its severity, it also matches with the duration and the quantity of alcohol that a person has consumed. So, this is how alcohol withdrawal works, where it leads to relapse and hospitalization if it's not managed properly. But with a better intervention, it can prevent a person to relapse and have a more of a long-term recovery. If you want, all of you can watch the series called Mom. It is a sitcom where the mother and daughter, they are trying to prevent their relapse from heavy drinking. So it's a fun show. There's nothing very finger pointed into the alcohol area, but you will see how they have this craving for alcohol because they have been so dependent on it for a really good time, and then now they're like trying to have a better life, and how did alcohol ruin their lives to begin with and how they're recovering from it. So you get to see the whole process in that series if anyone is interested in. And the other type of is other alcohol induced disorders. So over here, it's mainly prolonged use of alcohol or withdrawal of alcohol, which can induce a person to have other mental disorders, including psychotic disorders or depressive disorders, anxiety, bipolar, sexual, sleep related, or any neurocognitive disturbances. Basically, it sounds like I'm listing the entire DSM-5, but it's generally like that because it messes up with your brain chemistry. So it could lead to hallucinations or delusions, or it can lead to anxiety because you're not drinking a lot, or it can lead to depression because you're withdrawing and you can't do any change. So there's like a lot going on. So, with this, did everyone understand what alcohol use disorder is and what the related disorders are? Any doubts, anyone? Okay. Am I going too fast? Am I using a lot of jargon? Is everything okay?
Ma'am, here with the alcohol, actually, is it possible? Like reverse is possible, like if a person can practice self-control.
Can you please rephrase the question?
If a person want to control self-control over alcohol addiction,
Mm-hmm.
Is the reverse of all the damages is possible?
Damages in the sense relapse of them going back to drinking again.
No, damage is what alcohol created. Can be brain damage or like no depressions and suicidal moods and all those memory damage and all those things. And first of all, reverse is the reverse or stopping is possible on its own.
Sometimes, with the help of family support, yes, them to relapse can be stopped. And yes, some individuals, they do it by themselves without going to a psychologist or a counselor to help with their or to help with the whole withdrawal part. Maybe they can, what do you say, experience depression, or they can experience anxiety because they have been so dependent on it, uh, to a point where suddenly when they want to stop, they cannot stop it anymore. It, like, it sometimes willpower does happen. They can search up different coping mechanisms. So if they have a very strong willpower, then yes. If not, there might be a chance that relapse can happen, and it can co-occur with other mental health issues. But at the same time, if they get like an earlier intervention, then maybe it cannot worsen, and it can be like stabilized before it, worsens more than usual, if that makes sense.
And ma'am, see this disorder can be considered like after certain time period where the person cannot control. Otherwise, social drinking is also comes under the disorder.
Yeah, we, as I mentioned, social drinking can come under the alcohol intoxication, because in the end of the day, a person is consuming alcohol, right? So in that sense, we can say yes, a person is alcohol intoxicated, but we can't really say they have alcohol disorder, because they're occasionally drinking. They're just drinking for fun. They're not depending on drinking. That's just, they like the numbness of it, they like the thrill that they get out of it. But once they know that they have been drinking alcohol not because to have fun, but because they just don't want to associate with any of the stresses, that's when we have to look into the criteria and see, why are they using, or how long have they been using, are they using it with any other substances, or have they been like, are they, um, have they noticed that they have been using alcohol to depend on it. So before the dependency becomes even more, that's when therapists come to place, or family comes in place, or any support that they come to place to stop it before it gets worse, and like before they completely throw their life by depending on it.
Mm, yes, ma'am.
Okay.
Yeah, yeah. Thank you, ma'am. Okay.
Anything. All right, so we'll move now into the neuropsychological and cognitive implications. So, if we really have to talk about India, to be specific, the minimum and maximum initiation age of alcohol consumption is from 15 to 27 years, and in, if we do the math, it takes like 15.38 years for the duration of alcohol intake per person from the age like 15 to 27, right? And chronic alcohol use, as I mentioned, it does a lot of damage in several major parts of brain, and it changes completely on the way a person thinks or feels or behaves. So these changes, it can make it hard to simply decide to stop drinking. That's where self control comes, or the willpower comes. And this is because the brain itself has adapted to depend on alcohol. Now let's just say a person with diabetes, they have to take the medication, or else it'll the diabetes can sustain, but it won't completely go off. So they have to change their lifestyle, they have to depend on the medications, and if they don't depend on the medications, then their diabetes can come back up even more. So it can change into the different, like a severe level of it. So that same thing happens over here as well. And as I already mentioned, the reward pathway, it is also known as mesolimbic dopamine system in a more biological version. All right. So over here, the brain's motivation is center. Normally, this system, it releases dopamine, which is a feel-good chemical. And when we experience positive things like eating food or exercising or spending time with loved ones, that's when all these dopamine comes out. But people who drink alcohol, they get dopamine out of alcohol. But if they keep on drinking frequently and alcohol floods this pathway with dopamine, over a period of time, the brain starts associating pleasure only with alcohol rather than natural rewards. Like, let's just say you got a promotion today. So that the whole idea that you got promotion doesn't excite you, but you drink because you got a promotion. Now that excites you, like, oh my god, I got a promotion. And even another example you have to look into is that when one enjoys socializing a lot, or they have like a lot of hobbies, they may lose interest in them, and and instead they feel that only alcohol can make them feel normal or relaxed. So this is what happens in the reward pathway. Now second one is the prefrontal cortex, the red part. That's where prefrontal cortex is associated in our brain. It is like the function, one of its function is that it's responsible for judgment, for our impulse control, even our decision making. It's responsible for that. But when there's a long term alcohol use, there's less activation of all those three responsibilities that I mentioned. And this leads to more of a poor self control. And they have difficulty in making rational decisions. Even when the person know that the drinking is harmful, they cannot stop themselves. They cannot make the judgment like, oh, is it really that bad? They like, so, for example, someone might also go like, today I will start by just drinking one drink. So they start with one drink, but then once they start drinking, they find it so hard to stop, because the is brain control system doesn't know, like, it doesn't know, am I drinking, do I really stop at one drink, can I drink more? It's okay, two drinks won't hurt. And that two drinks turns into three drinks turns into four, and it just keeps on going. So that's what happens in the prefrontal cortex with those who drink heavily. Now third is hippocampus. So if I hope the image is clear, so this blue area in our brain, that's our hippocampus. Okay, so the hippocampus, it helps, the hippocampus's responsibilities, memory and learning. And if it is damaged, and it can be damaged by chronic alcohol use. So when it is damaged, a person will have forgetfulness, they are confused most of the time, they have trouble recalling conversations or any events, whatever happened before or after. Especially when they're intoxicated, they completely forget what happened. And this part is called blackouts, where they cannot remember what they said or did what they did while they were drinking the night before. So this is what happens in the hippocampus. And then there is limbic system. So, as I hope it is again visible over here. So the reward system, they keep on saying that happens in the limbic system. So over here, the small yellow dots, that's the dopamine, and this entire pathway is seen as the limbic reward system. Okay, so over here, emotional regulation, like alcohol affects the emotional regulation, because it's mainly through the limbic system that happens. And what does limbic system do? It manages the emotions like fear, anger and pleasure. So let's just say it's so activated that because of this, a person's behavior changes into being angry most of the time. Because of this, they cannot receive natural pleasure, but they need pleasure through alcohol only. And when this system becomes very unstable, it is like the person becomes more intense and unpredictable. So let's just say a person, he might feel very calm while drinking, But slowly, as they keep on drinking, they later experiences strong anxiety or guilt or irritability when they're sober. So these unpleasant emotions, they often push them to drink again, continuing the cycle of dependence. So you see how together all these brain changes explain why alcohol addiction is not just the matter of weak willpower, right? It has a lot to do with our brain. It's not just our behavior. Our behavior also occurs because of our brain. We do anything just because of our brain. Therefore, recovery often requires more than personal determination, and also it involves a lot of therapy, group therapy, medical support, rehabilitation, structured interventions, where we slowly help our brain slowly relearn these healthy patterns of reward system and emotional regulation. So, until here, did everyone understand? Anyone have any doubts? Something you would like to add on? Maybe you have seen it in your friends' behavior, or sometimes yourself, or something like that. Also, I'm not saying to self-diagnose yourself over here. It's just a discussion. Like anyone wants to add anything, if you are comfortable, you can put it up in the chat box itself.
Can you, ma'am, just a little bit brief all these four terms just in once?
All right. So, the reward pathway that helps us to increase our dopamine levels. Sorry, reward pathway basically helps in our dopamine levels. But when we induce a lot of alcohol, instead of naturally releasing dopamine because of happy events, you end up receiving dopamine through alcohol. So, is the reward pathway clear?
Yes, yes, ma'am.
Okay. And then for prefrontal cortex, because of excessive use of alcohol, the person has poor self control, which I kept on mentioning as willpower. So they have poor self control and they cannot make rational decisions, even though they know that drinking alcohol is harmful for them. And then the hippocampus, it makes the person prone to forgetfulness, confusion, or they have this thing called blackout where they are so intoxicated that they don't know what they have done when they were drinking alcohol. They don't even remember what they have done before they drank also, because of the amount of alcohol that has been induced within their body. And then there comes limbic system, which is more on emotional regulation, where a person, they can be unstable or their emotions become very intense or unpredictable once alcohol wears off from their body. I
Yes,
hope
ma'am.
it's clear.
Yeah,
Something, I guess.
yes, ma'am. Yeah. Thank you.
Anytime. So now we'll move on to the memory part of alcoholism. Um I hope it's not being too boring. If it is, let me know. I can add in more examples. We will be having a case study where all of you can put in your pointers. Since it's just 1.5 hours, I'm trying to introduce every aspect as much as possible and as easy as possible as well. So yes, thank you. So we'll look into alcoholism and memory. All right. So if we have to compare the results of their performance on all memory functions and sorry, all the memory functions test between alcohol dependent patients and normal controls. In some researches, which I have added in the resources area, if you guys want the resources, it'll be lifetime. So do look into for the resources, you'll get certificate as well. So in that, there was a paper that mentioned it was found on how alcohol-dependent patients showed more deficiency on almost all memory domains, and they used this PGI memory scale, where from that they understood to the healthy controls of the patient. So it just shows how the alcohol-dependent patients, they had global deficits in the test performance, that differed from the healthy control people. So healthy control people are those who knew how much they need to drink. They knew how to control themselves. They had the willpower compared to those who are alcohol dependent. And there was poor performance of the alcohol dependent subjects. Um, with their mental balance, their attention, their concentration, even their immediate recall, their delayed recall. So all of this has to do with the memory, right? So these factors, they indicated a lower capacity to retain and manipulate the information in verbal memory. So this is what happened for alcohol dependent subjects. Again, the paper has been in the resources area, and according to the model of memory by Atkinson and Shiffrin, it's a theory given by them about memories and how they're formed in three main stages. So, if anyone knows three main stages of memory, can someone either name them out or like explain in short? Just a hint, I'll say it has long term memory in it. So, what are the other, that's the last stage of memory. What are the first two stages of memory? There's no
Short-term
multi-
memory, immediate memory.
Yes, so as, sorry?
Short-term memory, long-term memory, and immediate memory.
Yes. So as you rightly mentioned, there is sensory memory, short-term memory, and long-term memory. So sensory memory is for others. I'll just brief it out slowly. Sensory memory is the information from the environment, like sound or sights, which is briefly held for a few minutes. As ma'am rightly mentioned, that's like the immediate memory that you have. Short-term memory is where if we pay attention and if we break down the information, that information stays active for a short while, probably for like few seconds, like 15 to 30 seconds, it stays in a short-term memory. And then it's been transferred to a long-term memory is when we rehearse or deeply process the information. That is when it permanently gets stored. I sort of mix up short term memory and long term memory, my bad. But short term memory is if we pay attention to something that has been encoded to a long term memory, and it stays in a long term memory only if we rehearse it multiple times or we decode what that information that we have learned. So these three are the types of memory that Atkinson and Shiffrin had looked into. Now, alcohol mainly affects the transfer of the information from short term memory to long term memory. Meaning, when a person is drunk, they can only remember things for few seconds or minutes, but may not be able to store those memories permanently. If I have to go with an example, a person they can follow a conversation, they can talk to anybody when they're intoxicated, but after the alcohol reduces, they forget who they have talked with, they forget what they even spoke. So what was said, because those memories they never made it to the long term storage. Firstly, they did not pay attention. So because they did not pay attention, I would just be in the sensory memory. It's their immediate, that's their immediate response. They did not pay attention, they just spoke. So since they didn't pay attention, it hasn't been to the long term memory, hence they couldn't recall what happened the previous day or who they talked to. So this just explains why people may, like some people, they may seem alert or even coordinated during drinking, but also not have any recollection of events later on. And there were a lot of research that happened. I think uh, there are two or three papers that I've added. So over there, one of the researches was that how it they found that the impact depends on the amount of alcohol that has been consumed. So with low to moderate levels, memory problems are mild, where people may forget small details or parts of a conversation, which is called the cocktail party lapses. Does anyone know what cocktail party effect means?
No, ma'am.
Okay, so cocktail party effect basically means that you are in a crowded room and suddenly you hear like there's a lot of noise already around you. There's a person talking to you, there's a music around you, there's a lot of sound of plates and glasses and everything. But suddenly you hear your name being called out from a distance. It may be suddenly you hearing it or someone actually calling you. That is when you shift your attention to it. So that's something called cocktail party effect. But over here, when someone has consumed a lot of alcohol, they have a cocktail party memory lapses, meaning they don't have that attention, like that immediate attention to something you are already tuned with a lot. And if I hope this made sense, this sentence made sense.
Yes, ma'am.
Okay. So now if you have to talk with high levels, the memory problem can be very severe. In the sense, it can result to blackouts, which we have talked before. So they have periods when a person is awake and active, but later they cannot remember the entire event. So maybe let's just say before they went to a club, they remember that they got dressed, they went to the club. After that, no idea. That's all. So this is the higher level of memory problems. And if we have to talk about blackouts to be specific, there are two types. One is en bloc blackouts and fragmentary blackouts. So en bloc, I'll just type down the spelling of it. Uh, a minute. En bloc blackouts. So these two are two different types of blackouts that I am discussing right now. So the en bloc blackouts, it's the complete memory loss that a person has for a period of time. So the person cannot recall anything no matter how they try. Someone like some might even drive them home, they talk to friends, or they even send messages while they're drunk, but they have no memory on whatsoever when they have done it, at what time they have done it. They don't have anything, no matter how much they try to recall. Then the second type is fragmentary blackouts, where they have partial memory gaps. So the person, they may forget some parts of the night, but they can remember details when reminded of. So let's just say some may not remember how they got home until their other friend mentions, like, oh, I gave you a ride. And it's like, oh, right, I do remember. We did book an Uber, and that's how we got home. So that's called fragmentary blackouts. So, if, like, when we talk about blackouts, some scientists, they mention how they once wondered if these blackouts are called state dependent, meaning if people could remember what happened only when they're drunk again. So, this is what one assumption was by the scientists, but research did show that it's not the case, where becoming intoxicated again doesn't really help recover those lost memories because it's already lost. They haven't paid attention, so it wouldn't come back again. So, with this, we just understand how alcohol interferes with our brain's ability to even create a new long term memory while being intoxicated. And for people, it may appear very functional in the moment, but the brain itself is failing to record those experiences properly, is something that needs to be looked on by those who have these situations very frequently, because it is very those people are very prone into leading to memory gaps or complete blackouts, of even ending up to depend on how much alcohol is to be consumed. So I hope both the brain part that we have mentioned, like how it affects different parts of our brain, as well as how it affects our one specific part, that is memory. I hope this made sense to everyone. Any
Ma'am,
doubt?
can you please repeat en bloc blackout? What
Uh,
it means?
In block blackout is basically when a person has a complete loss of memory, like they do not remember anything at all. So you cannot, even if you try to let's just say today a person, they drank so much, the next day they wake up, that's all, that's all they just remember. They went to a club, they drank, and next day they woke up with a hangover. They don't know anything that has happened, who they have talked to, what did they drink, did anybody even mix anything with their drink, how did they go home, nothing. They just, it's a block of memory, that's all. So that it, the word itself is end block, so it's a block of memories. Fragmentary, fragments, so it means you partially remember it. So I hope that makes sense.
Yes, ma'am. Thank you.
Anytime. So one question was that after drinking alcohol, the clients will get increased dopamine level, so they won't get the same dopamine level when they do other pleasure giving activities. And clients with alcohol addiction, we give therapy like cue exposure therapy, active imagination, and other techniques like behavioral activation through CBT, etc. And we cannot give the clients who drink alcohol only for increasing happiness level. So, as an alternative, therapist can't suggest other pleasure giving activities like playing any games or doing a hobby, etc. Yes, that's a really good question. Yes, you are very right that alcohol does increase the dopamine, and it does increase the brain, like it does change the brain reward pathway for them and how it adapts and everything. So yes, one thing is that for, if a person goes just for counseling, um, you wouldn't really directly suggest them what to do. Yes, you will give through different therapy methods, you'll let them understand how it goes on or how they can cope with it. And even though the client doesn't initially feel much pleasure with the help of CBT or other alternative reinforcement, which is very extremely important, by consistently engaging them in these meaningful or healthy activities, the like slowly introducing other alternative things, like let's just say the client themselves goes like, yeah, I can go on a walk, sometimes that did help me when I'm very stressed. So we can ask them, like, why don't you try slowly going for a walk every day rather than having a glass of alcohol. So I'm not saying that they completely reduce it. So maybe say they have 3 glasses of alcohol. So we can say like maybe try 2 glasses for a day, and then try going for a walk before you do that. So in that sense, your brain slowly relearns to release dopamine naturally. But again, this is a huge, slow process. So the therapist can somewhat give a like introduce activities, like they can try, ask them, can you search different coping mechanisms instead of relying on alcohol. So when the client themselves come, they can like search it on the spot or something that they have heard from someone else. They can mention all of that, and we can let them, like, direct them to see like what activities would they like to go on with, like what are they interested in. Because as a therapist we can't directly suggest them anything, because that's when instead of alcohol they'll be dependent on us. That's something we don't want. uh, that is one way that comes under our ethics, that you shouldn't be like suggesting a thing, but they have to come up with themselves. So in this way, even though people are addicted to alcohol, they may not feel pressure from normal activities at first, but slowly continuing those activities step by step over a period of time, the brain can slowly heal. So maybe the therapist can remind the hobbies that they have been doing and ask them, like, why they have you stopped it, can you try continuing it, something like that. So that deepens the therapy, and it targets the reason why they have started drinking in the first place, and that's how they can regulate themselves on how to discontinue or not to relapse from drinking. So I hope that made sense. Okay. Just a second. All right. So until now, we learned very theoretical manner of what happens and everything. But what do you do when you actually get a client in real life with this disorder? So for that, I'll introduce you all to some assessment tools. All of these tools have been shared in the resources drive. So if whoever has purchased, please do look into it, or like after the workshop, to have like a better understanding. So these assessments, whatever that has been shared, you'll get the questionnaires of it, plus how you score it and how you interpret it. So it helps you understand all of that. So first one we look into is the audit scale, that is alcohol use disorder identification test. So it was developed by WHO to detect early signs of harmful drinking before it becomes very severe or it leads to dependency. So it is a 10 questionnaire assessment, which assesses three main areas. One is alcohol consumption, in the sense how often or how much a person drinks. Then there's dependency symptoms, such as difficulty in stopping once drinking has started. So it tests that area as well. And third is alcohol related problems, in the sense that have they injured themselves during whenever they had alcohol, or do they feel guilty once they have it, or have they ever experienced blackouts. So these are like the three areas that this test helps us to assess, and each question is scored on the scale of 0 to 4, and the total score helps us to see whether the person's drinking is low risk, or if is it risky, or if they're dependent to alcohol. For example, if you ask there's a question on how often during the last year have you been unable to remember what happened the night before because of drinking. So a higher score of this question could indicate more problematic drinking behavior. This is very like an example version of how it has been scored or assessed. And why is this assessment is used is because for us as therapists, it helps us identify people at early risk, of like early risks for the client. So before seeing their medical before their medical or social problems worsen, if we give this test, we are able to identify earlier, and then we can see the interventions that can happen. And this test is used in various areas, like in hospitals, universities, or community clinics, to just either psychoeducate them or to guide brief interventions, or even refer therapy to these individuals. Second one is MAST, which is Michigan Alcohol Screening Test. So it is one of the oldest and one of the most widely used screening tests for detecting alcohol related disorders. So over here, it has like 25 questions of yes or no questions, through shorter versions, like even the shorter versions exist. This one has been like very old, since ages they have been using, and it focuses on how alcohol use has affected a person's health, how it has used their affected their family, how has it affected their work, or even their social life. So some questions out there in the assessment is, have you ever lost friends because of your drinking? So yes or no. The person ticks whatever it is. Or have you ever had a drink first thing in the morning to steady your nerves? So yes or no. Some might say yes, some might say no. So each yes response adds to the score, and the total indicates the level of alcohol related problems. And the reason why this um test has been used so widely is because for audit it just looks at your current drinking state, but with the masked screening test it gives you a long term picture of how the person's alcohol use has been so far. It's very useful in clinical or rehabilitation centers to have a more better idea on the chronic nature of alcohol misuse and what's the impact that it had in a person's life. Then comes, I'll do one more, what do you say, assessment, and I'll show how they look, and I'll go with the other three assessments. Okay. So for DAST, which is drug abuse screening test. So the DAST is used to identify drug misuse and dependency, excluding alcohol and tobacco, because some people they sometimes mix alcohol and other substances. That's when drug abuse test can also come when they mention that, like, yeah, I do have alcohol, I do have other substances as well. So during that time, they do this type of test. So it basically helps them screen for like substances like cannabis, cocaine, opioids, and prescription medications. So over here also it's like a 20 questions questionnaire with yes or no questions. It has very similar structure, like it has a similar in structure with masked assessment that we have talked about. And as I mentioned, it talks on how drug use has affected a person's personal relationships, how it has affected their health and even their daily functioning. Some questions were like, have you neglected your family because of your drug use? Or have you engaged in illegal activities to get drugs? So these are some questions that you can see in this type of assessment. And the reason it is being used, as I already mentioned, is because it co-occurs substance use, meaning like alcohol and everything, which is very common among people who have alcohol use disorder. So those who drink heavily, they also misuse painkillers or sedatives. So this is why this test has been done. uh, I'll just show how these assessments look like. So this is how audit assessments look like, where it is rated with out of 4, and then whatever scoring comes we put it in this box. So like that 10 questions are there. All right. And then this is for masked test, screening test. Like this they have 25 questions with yes or no like questions, and then every yes question has its own marking to see. And then there is DAS, the drug use test. Since the yes or no structure is very similar, that's why it's said to be very similar to MAST. And over here, they mark like, what they use, like which substance do they use a lot. So that, and over here also there's like a question, how often have you used, like monthly or weekly or daily? And in the obviously in the end, they show like how you can score or interpret these assessments for like your better understanding as well. If you want, there's this movie you can see called watch, called Christine F. I think it's a German movie. It clearly shows on how substance use in general affects a person. So it's a nice movie to understand how substance use, how that person relapse from substance use, even though it's not alcohol, from other drugs, how they have misused and how it affected their lifestyles will be seen in that. Now, the other three is MMSC, that is mini mental state examination. So, mental state examination is basically where you take all the history of the client. But the mini one version is it accesses the cognitive functioning on, that is like how well a person can think, remember, pay attention. And with chronic alcohol use, what all areas in the brain has been damaged, and how did it affect the memory and planning. So that is what this examinations help us understand. So it has like 30 points that takes about like 10 minutes to administer, where they see their orientation, meaning knowing the date, time, and location of when the assessment has been taken, the registration, where there is recalling and repeating of words, the attention and calculation, like simple tasks like counting backward by seven, or recall in the sense remembering the earlier words, language and construction, naming objects or drawing shapes. So maybe you can ask a person, what is the date today, or can you spell the word world backward? It might sound so stupid or easy, like, who cannot spell world, who cannot count seven backwards? For us it can be normal because our brain is healthy, which is really good. But MMSE is often used when doctors suspect alcohol related brain damage, like how I mentioned before, there's Korsakoff syndrome. So, or even early cognitive decline because of substance use. So during these times, this examination is given, which gives like a small, quick understanding of how your brain functions on day-to-day lives. Then there is PANSS, that is Positive and Negative Syndrome Scale. So over here is the severity of psychiatry symptoms, especially for those who have mix of psychotic or thought-related disturbances. So it is, while it was originally designed for schizophrenia, it can also be used when or drug use can trigger psychosis like symptoms. So even this screening has like 30 items, which is divided into three scales. Positive symptoms, which has hallucinations and delusions. Negative symptoms, that has lack of motivation and emotional flatness. And general psychopathology like anxiety, depression, or guilt feeling. So a person might rate the intensity of the symptom from scale of 1, which is absent, to 7, which is extreme. For instance, does the person hear voices when no one is around, or when they are sober, or when they are in alcohol? So, like that, those type of understanding can be coming from this assessment. And yeah, pretty much it helps us access how alcohol affects their mental state and whether psychiatric treatment is needed alongside with the addiction care. And lastly, we see assist with third version, um, comprehensive assessment, which the assist full form is alcohol, smoking, and substance involving screening test. So again, this was developed by WHO, where this test screens for the use of multiple substances like alcohol, tobacco, cannabis, cocaine, opioids, and many more. And it just shows how much risk each substance poses for health. So it includes questions about the frequency of use, based mostly in the past 3 months and lifetime, the craving or desire to use these substances, the problems caused by them, or the concerns expressed by others about their use. So let's just say one example question could be like, in the past 3 months, how often have you had a strong desire to use alcohol? So accordingly, the responses are scored, the total scores are placed, and then you get to see the how, like the levels. Is it low? Is it high? Or is it moderate? And it also matters for us to use this type of comprehensive overview, because obviously a lot of substances are used and you need like a quick understanding of it, and then you can do your intervention, right? So to have an early intervention programs, this is like a good tool to use. So I'll just show how these three assessment looks like. So this is MMSE, to help a person understand how it works. And this is the PANS test that I mentioned. You see how it is from 1 to 7 rating, where 1 being the lowest, 7 being the highest. And then this is the assist version 3. Again, this it's a yes or no questionnaire itself. So just to have like a overall understanding what all have they used and since when. So these six assessments are some that can be used along with other assessments like depression or anxiety if they are comorbid with them or other disorders. I all these six have been shared in the resources if anyone wants to access them. Please do not self diagnose yourself, or please do not use these assessments um, if you aren't an eligible counselor or a therapist, since that's illegal. So, only if you're a certified therapist and you have completed all your education, you are allowed to use them. But you can use it for your education and everything. I hope the assessment tools made sense. Okay. How is everyone doing? I know it has been a good 1 hour right now, and it's just been so theoretical and a little bit practical. So, how is everyone's mood like? Because we're gonna end soon with the case studies, I just want to do like a quick check in with everyone. I know it's very hard, like it's a very heavy topic. There's a lot of information, a lot of brain related stuff. So, out of 1 to 10, what do you guys say?
Yeah, ma'am, it is little good to understand and increase our knowledge on this field.
Okay.
May I know when I able to use it? I mean, in my personal knowledge, I can use it for family or suggestion, but by professionally when I can.
For personal knowledge, in the sense like how you had a understanding on where which assessment can be used, is for your personal knowledge. You suggesting to your family members without yourself being a therapist or a counselor is not really seen to be put out there, because obviously even though you know how to do the testing, it is not like it would give them a little biasness, like, or it would give them ki ha, I have a disorder now. So it's just not good for that. They will be very stubborn with it. But if it's done in a professional setting, or if you yourself are a professional counselor or a therapist, or you work in a rehabilitation center, then yes, you can ask your supervisor, can this assessment can be used, or we can add try adding this assessment if it hasn't been used and you think it might work with the client. Or maybe you want more information, so some of the assessments gives a lot more information than the others, so that's when you can use. It's just that since these assessments are very out there, people might misuse it. That's why we just give like a disclaimer that please don't misuse it if you're not a like legal trainee in this field. That's what I meant.
Yes, ma'am, got it.
Okay. So um okay, do you guys want me? We'll go with the last topic of the day, that is a case study, to properly understand everything that we have talked up until now. And I would like to hear your point of view on how you would like to treat the person, or what assessments would you like to use, or what is going on with this person. And if anybody wants to share why are they acting this way and link it with their brain activities, it's an open platform to discuss whatever you have understood until now, or whatever you have known from your previous knowledge. All right. So, does anyone want to volunteer in reading the case study?
Yes, ma'am, I will.
Okay. Is it visible?
Hi. Before we go on to the case study, I just have a little doubt. Uh, so, counseling, we always do counseling only when the client is ready for it and when they accept that they have a problem, right? So,
Yes.
there are many people, especially with relation to alcohol abuse and alcohol disorder, they wouldn't agree that they have a problem in the first place.
Hmm.
So, how can we help them then?
So one thing that I have learned throughout, or something that my supervisor would keep on mentioning, is that therapy works or counseling works in a person, as you have rightly mentioned, when they accept that something is going on and they would like to fix it, or when they aren't aware that something is going on but they're ready to seek help. But when someone is very stubborn, like they do not want to listen to you, they do not want to agree with you, it's genuinely nothing we can do as a counselor to help the client, because it not only doesn't, you wouldn't see any improvement, it just, they themselves won't show any interest, they wouldn't really care. So that's when you don't force the client onto anything. Maybe work on different factors that might happen around, but when they are not ready to accept something, we can't, that's not their goal for now. Their
Yes,
goal
yes,
is
yes.
not to fix their disorder. Their goal may be to fix their work life. So until and unless they realize that they have to work on it, that's when you can help. That's when you can use your interventions. That's when you can use different therapy methods. But when that's not at all their goal, then I'm sorry to break it. It's really hard to say, but it's not in our hands. We just have to accept with it and work with the things that they would like to work on.
Yeah, yeah.
Yeah, that's
How
just,
Ma'am,
unfortunate.
yes.
sometimes like they want to quit it and they accept it, but by society knows or how see them that stop them. In that case, they didn't want to counseling, take classes, or continue. They just break down to how to.
It psychoeducation comes in role during these matters when, because of societal norms, they wouldn't like to come for therapy. It is, in fact, a very sad reality. I know psychoeducation sounds like a very big thing for us psychologists or those who are learning psychology. They say psychoeducation, psychoeducation. But in reality, even if people are being psychoeducated, they still don't want to go with it. And we can't really force into a person coming into therapy. We can only suggest that, we are open to listen to you, we don't judge you, whatever you speak is not going anywhere, and we are here to help you, we are here to hear you out. That what happens. And the other side, other drawback is that no matter how much, let's just say the client tries, they do all the homeworks that you give, all the exposure therapy on like the natural way of coping or anything, they themselves come with their own coping mechanisms. No matter how much they do that, if their peer support is not very supportive, like their family members were like, so what, you can have one drink, it's okay, you won't relapse. They aren't aware, they are not psychoeducated, but the client is psychoeducated. So if a client is coming to the room saying, stating these concerns, we can help them build themselves as a person. But other than that, we can't really force them into coming to therapy just because of the societal norms. But we can go around psychoeducating, be it from family or in school or in colleges. I'll hope that I like replied to that. Someone mentioned in this situation we can try to increase the insight level by psychoeducation, and we can also do like people do in movies, like showing videos of smoking and consuming cons video. Yeah, that's called exposure therapy, or that's this called or you help them understand, you root them into it. That's how some most of them works. But when the client themselves is in denial, we can't really do anything. That's just sad part of therapy. It's just a very hard thing. It's like you genuinely can't do anything. Yes.
Ma'am, may I read the case study?
Yes, you may read it.
Rohan is a 29-year-old marketing executive living in Mumbai. Over the past 3 years, he has been drinking regularly, using 3-4 large packs of whiskey Every evening after work, initially he drank socially with friends, but gradually it becomes a nightly habit. Should I continue or will explain?
No, you may continue.
Rohan says alcohol helps him switch off after stressful work days. He recently began drinking even when alone, especially when he feels anxious or frustrated. His girlfriend and parents have expressed concern, saying he become irrit- irritable and forgetful after drinking. Last month, Rohan was late to work several times and received a warning from his supervisor. He admits feeling guilty and promises to cut down, but finds it difficult to stop completely. Recently, he noticed shaking hands and restlessness when he tried not to drink for 2 days. He drinks again to feel normal. Rohan says, I know it's getting out of hand, but quitting scares me. I have tried before. I always end up drinking again.
Thank you so much for reading it out loud. Did everyone understand the case study? Give a thumbs up, please, if everyone understood. Okay, so I'll be asking some questions so that you all answer it to me rather than me explaining now. So, what are some key signs that you notice where Rohan meets the criteria for alcohol use disorder?
Quitting from work, he's not able to go to work because of his habits and also withdrawal symptoms as he's shaking hands and this restlessness. Um, yeah, those are the key points. And he's also being irritable and frustrated when he's not doing.
Yes, absolutely right. Anyone else?
When he want to quit and think that it scares him. And as you this mentioned, her girlfriend and family members supported him, so he can slowly like show some courage to scare over courage. I mean to stop scaring.
Yes. Yes. So as everyone mentioned, it's completely right. We just one more question to that first question that I asked, that have you noticed any negative effects that's affecting his daily life, and what are his thoughts about it? Like, what is the negative effect that's happening, and what is the response to it?
Ma'am, like feeling anxious and frustrated. So, family or relationships issue happen
Okay.
and become forgetful, which is totally good, not good for as a supervisor. I mean, as his job, for his job. And when he want to stop after knowing this, his body doesn't support him, so he again drink.
Absolutely right. So
It's a loop like.
yeah, so as you rightly mentioned, how he experience and others as well, how he experiences withdrawal symptoms, he shows tolerance, he feels guilty, he continues despite knowing the negative effects on his health, even on in his workplace and his relationship. So over here, it indicates his loss of control and dependence on alcohol. Now, second question is, what biological and psychological factors that might contribute to his drinking behavior? There's this one system that I've been talking about the entire time when we were discussing about the brain and memory.
Ma'am, psychologically, I mean socially, in friends gathering, he get addicted to this habit. So
Yes,
when he alone, he sometime maybe tried, then it was helpful to him, then it's become regular.
yes. Anyone
And
else?
biologically, it creates dopamine.
Yes. Was someone in the comment, and as well as you, both of you mentioned as the reward system, that's the dopamine system. Both of them correct. Even psychologically, whatever you mentioned, even that's correct. So both active for bio part, it's the brain reward pathway, which makes alcohol feel pleasurable and reinforcing use. Where he mentioned that he drinks again to feel normal, and for psychologically he uses as a coping mechanism for stress and anxiety, specifically because he mentions how he cannot stop drinking because he is scared to quit it, and also he there's like a temporary numbing of his emotional discomfort. So because of that, he this is how it affects both his biological and psychological factors. Now I will yes.
Maybe he can quit it after some time, but in mind he accepted that he can't quit it because of before experiences.
Perfect. Yes, that's exactly how it occurs. So when a client comes in saying, "I want to quit, but I don't know how to," it will take a long period of time for them to get used to that thought. But because we have to change their belief that they cannot quit it at all. So once it's changed slowly, they can reverse their lifestyle and actually cope with something else other than alcohol. Now, I'll introduce these two therapy methods. One is motivational interviewing, which means where you can enhance the readiness to change by resolving the situation. And second is cognitive behavior therapy, where we target maladaptive thoughts and behaviors. So, I hope these two therapy methods made sense. Just give a thumbs up if it did. Okay, so if we have to take for motivational interviewing, how do you think that this method will help in his case? For example, he mentions that he wants to quit, but he's scared to quit. So, how will you, if he is your client and he tells the statement, how will you enhance his readiness to change?
Ma'am, if I will be as a motivational for him, according to my knowledge, I just say like there are many behaviors which we think we can't stop, but at the end we can.
Hmm.
After regular practicing or friend support or going to new environment, learning new skills. So because of his said accepted that he can he wanted to quit it, so but his body is not supporting, so by day he can meditate or do yoga something to refresh it, and slowly he can by personally he gain under over confidence that he can quit it. Maybe I am wrong.
Yes, so,
Uh,
yes, ma'am.
yes. I was going to say that I would start with appreciating him for coming forward and taking the first step, which by itself is a big step because he realizes that he needs help. And also get to the core of what causes the anxiety and the stress to which brought him to the dependency, right? So initially, what caused the stress, and I would listen to him talk about more of his problems, so that he can vent out all of his stress and realize himself that if that stress is the main factor for this alcoholism and dependency and everything. So I would just go on from there and move forward.
Absolutely. As both of you, and also there was a comment that mentioned about will appreciate his willingness to try. All these three are absolutely right. One small change I would do from the first one is that we wouldn't really tell what he can do, in the sense like we can't suggest him like do meditation, do this, do that. We can't really suggest him specifically, but we can let him explore his own reasons for change, without making him feel judged or rushed. Like we are not putting him any sort of pressure. Maybe his family and friends are doing key, like or and main example, his boss. He's telling like this is not it, and this is like your last warning. So that makes him feel pressured. It doesn't give him his own pace to like change. So exploring that and giving him his own reasons, because he wants to do it. So how he would bring, why is he doing in the first place? So it just reduces his resistance for not wanting, not sorry, reduces his resistance to like I cannot stop drinking. And it ends up building his internal motivation to recover with, as you guys mentioned, the appreciation and letting him know that it's completely all right to feel the way you are, but here we are working together with it. And obviously nobody is rushing you to it, so you can take your own time and pace to understand what makes you want to stop drinking and how are you planning to do it. Or have you seen others doing any coping mechanisms? Has there been any coping mechanisms that you have already tried but it wasn't effective enough? So, like this, we can let him explore by himself rather than us suggesting them. And appreciation works a lot over here, because obviously he feels very judged at this point, he feels very pressured. So, to tone that down a little bit, we use appreciation as well. Good job, you guys. With the second method, how do you think CBT, that is cognitive behavior therapy, can help to support him? I'll just give like a small example to push for you guys to think. Reread the sentence where he says, I need alcohol to relax. So, yes, cognitive restructuring. Can you elaborate more on that, please? Exactly. We wouldn't exactly say negative thoughts. We can say irrational beliefs or irrational thoughts of his, because maybe the thoughts that he has cannot exactly be negative thoughts. He can't really situate which thought. Yes, the more to more rational thoughts changing is what we can say. So, anybody else want to add on to this sentence? Cognitive restructuring from irrational to rational thoughts and beliefs?
I would also probably question him because here, with relation to changing irrational to rational, he says that it helps him switch off after stressful work days. So maybe we can start inquiring, asking him on when he actually started using alcohol and when he actually felt that he was feeling relaxed after drinks and how life was before that, how he
Perfect.
dealt with stress much earlier.
Yes, exactly. So with the help of CBT, we can help him recognize those thought patterns, like I need alcohol to relax or I need to feel normal. Whereas we can help him replace those thoughts into much more healthier alternatives. Like I can relax through breathing or exercise. And it just builds coping and problem solving skills for his actual real life stresses. Obviously, we will slowly introduce s- m- small activities like grounding techniques, and then eventually, as you have rightly mentioned, on how it all started after he himself realizes how his life was before his dependence and how it is after his dependence, he himself can come up with his own coping mechanism. So we can ask him, like, go search up, see around what you can do, try, and come back and let me know what can be done. Or if possible, you can ask them that in the session itself, ask, like, open Google, search it up. This Google has a lot of coping mechanisms. There are a lot of tips and tricks that it gives. So search it up and see what you might like to try this week. Probably something like that. So with this, CBT can also help a person. So I hope this case study made a lot more sense with the help of two types of therapy methods that we can look into, and also how an actual case can look like. Even though this is a very hypothetical case, this can be a real case for a person who we are not known for. So, with this, we end with alcohol use disorder. I'll just summarize very quick on how we started with alcohol use disorder and understood how it is not just about drinking too much, but it's the chronic based, brain based condition that happens that leads us to diagnose it as an alcohol use disorder, because it affects our thinking, our emotions, our behavior, and all. 1 minute. Yeah. So we saw all that in how alcohol use disorders, that repeated use of leading to tolerance, dependence, withdrawal symptoms, and continuing drinking despite harmful effects. We saw how recovery requires more than just willpower, and it often like involves a lot of psychological therapy, medical support, even social rehabilitation works, and helping the brain relearn healthier coping mechanisms. So with this, we also see the neurological side of alcohol use disorder. We have seen some assessments like audit, MAST, DAST, MMSC, PANS, and ASSIST version 3. All of these assessments are given in the resources for memory, specifically for alcoholism and memory. I have shared couple of research paper. When it comes to case study, like how we have discussed two therapy methods, some worksheets have been shared for you to understand what worksheets you can use as a therapist to your client. Again, all these assessments or worksheets, please use it in a legal version. We do not want it to be misused. That's the whole concept of us sharing these resources. It can be for your own knowledge as well, and for you to use it once you are capable for using it, meaning you are a therapist or a counselor or a rehabilitator. And with this, we come to an end with today's workshop. I hope all of you enjoyed it. I hope you all are going back with something. And I hope I answered all of your doubts. If you were not comfortable sharing it in call, you're always free to message it to me. Before I go on with asking if there are any doubts, I would just like to let you all know that we have upcoming workshops coming up. That is on 7th and 8th, we have a systematic desensitization workshop. And also on 12th, we have another workshop on cognitive. So please do sign up if you're interested in it. And whoever wants this PPT, whoever wants the access for worksheets, the assessments, the research papers, and other resources, do text Ria ma'am for them. You would get both a certificate and a lifetime resources. Uh, Thank you so much for attending, ma'am. And does anyone have any doubts? No one? Thank you so much for attending. I will share whatever I've spoken, all the types and everything will be shared in the resources again. So,
Thank you, ma'am. Ma'am, can we get the recordings?
yes, all of this will be added to the resource drive. The recordings, the slides, whatever I spoke, that's not in the PPT because it's just very concise. All the assessments, everything will be in the drive.
Okay, fine, ma'am. Thank you.
Thank you. Will all of this be shared in the same group?
Yes, it will be shared via, like, you have to fill a Google form, and via that, after like in a day or two, you'll get all your resources and certificate.
Yes, yes, through email, you mean?
Yes,
I've
through.
already paid for it. Yeah. All right. Thank you.
Yes, yes.
It was a lovely session, by the way. Thank you.
Thank you so much. I'm glad everyone enjoyed it and glad everyone got an
Thank you.
experience.
And the best part was that you didn't rush it at all, and still you managed to cover everything.
Thank you so much for that.
Yeah.
Yes.
Thank you, ma'am. Thank you. I even registered for the systematic desensitization also.
Okay. I hope you have a good session. It will be really informative.
Yeah, in between, actually, I was not able to be available actually, but that's why want to go ahead with the recording also.
Yes, yes, everything. If you don't understand the recording, the pointers will be also given to you, so you can refer that, or you're always free to reach out to us.
Yeah, ma'am.
Okay. Thank you
Thank,
so much.
thank you, ma'am.
Bye. Have a good day and a good night.
Good night.
Bye.